Don't be bemused, it's just the news. Good day, Ahisha Radabaras, covering stories, waving truths, here to start your day with another rather shocking article. Shanghai, known for their iconic skylines and vibrant culture and cuisine, just released a shocking statement, stating that from December 26, 2017 onwards, they will permit only 800,000 residents to live there, capping this known Chinese city's population permanently at 25 million. The known Chinese economic hub holding its population in the given year at 24.5 million, authorities unfortunately were raising a plan to hold a permanent population of 25 million as news spread fast. For a wider coverage of this article, Carlene, can you please tell us the reason as to why this has occurred? What is the reason behind this, Carlene?
Thank you, Aisha. As published in the article, the main idea behind this newly crafted concept through year 2035 is to restrain societal diseases common to major cities such as environmental pollution, gridlock traffic, and a seemingly decline in the quality of public services such as medical care and education. These getting referred as big city diseases by the State Council. They also added the mention of the amount of land made available used for development for the upcoming years will eventually be limited soon. In Shanghai Academy of Social Sciences, a research fellow predicts that possibly the poor will bear the force of the new population limit the most due to the government having plans on tearing down cheap housings in existence, him showing an imposing side in regards the limit warning that it is unpractical and against the social development trend. Meanwhile, China similarly hoping to reduce Beijing's population at 23 million by 2020. Plans already being in the works to move government offices out of Beijing. To move a new city being built to the south about 50 miles.
Thank you, Carlene, for the breakdown. But I've heard there were updates regarding this article, if I'm not mistaken.
Yes, indeed. China's commercial capital, Shanghai, just experienced its first population decline in 5 years, dropping from 24.89 million in 2021 to 24.76 million in 2022 in just a year. The reason primarily being due to strict COVID-19 lockdowns and the departure of over 250,000 migrant workers. This seemingly spreading trend aligns with national data as China registered its first population reduction in 6 decades. A 60% significant count of Shanghai residents started to prefer one or even none in terms of having a child, and more than 28% polled saying they don't plan on having additional child due to the high childcare cost. Childbirth rates fell to 4.4 per 1,000 while the deaths rose to 6.0 per 1,000, majority due to an aging population with 18.7% of residents over 65. Concerns raised because of how gradual China's population was decreasing, so political advisors suggested over 20 measures to address declining birth rates, though the experts believe this may only slow the decline rather than reverse it.
The COVID-19 indeed made an impact in society as stated in the given breakthrough. Though living was changed, people learned to adapt during that time.
Before the demographic transition even started, life was considered short along with high birth rates. Growth were also considered slow and the population was young. But during the transition, both mortality and fertility declined, causing the population growth rates to increase and accelerate, and eventually slowed again, moving towards low fertility. And of course, as a result of that, long life and old population. This transition first began in the year 1800s with declining mortality in Europe, and as of now, it has already spread all around the world and is being projected to be completed by the 2100s. This demographical transition has brought momentous changes, altering the economic and demographic life cycles of individuals, restructuring populations. Since the year 1800s, the size of global population has already increased by a factor of 6, and by 2100s, it is expected to increase by a factor of 10. Individuals' length of life, which already has been more than doubled, is anticipated to be tripled, while births per woman will have dropped from 6 to 2. Before, in the 1800s, majority of women spent about 70% of their years as adults, bearing and taking care of young children. But this fraction has already decreased in numerous parts of the world to only about 14%, and of course due to low fertility and a much longer lifespan.
As we receive a glimpse of history from Rafaela, we learn the truth regarding topics inclined with world growth, mortality, and fertility. Now, we'll dig deeper and explore the concepts of mortality declines and fertility transition. Rafaela?
Yes, Ahisha. As we know, mortality decline refers to a significantly sustained reduction with regards to death rates. Also connects the increase in life expectancy within groups or population over time. It is driven by various factors including but are not limited to advancement in socioeconomics, public health improvements such as better personal hygiene, nutritional improvements, specific medical tech, and the most relevant factors, which is better living conditions, leading to healthier and longer life expectancy. In the land of Northern West Europe, where the world's demographic transition started and where mortality began a secular decline around the year 1800s, is the place where it all started. The first stage of decline is because of a reduction in contagious and infectious disease transmitted through air or water. That is why preventive medicines were significantly valued in the concept of mortality decline in the 18th century.
Rafaela, there are probably reasons as to why mortality decreased throughout times.
Yes, there are, Ahisha. For the past decades, the progressive reduction in mortality is due to the continuous decrease in chronic and degenerative diseases, while in later parts of the century, rates of publicly organized and funded biomedical researches played an increasingly important role. Both Human Genome Project and stem cell researches promises future gains in humanity's mortality. An example of these transitions is the life expectancy in India, increasing from around 24 years in 1920 to 62 years in today's time, a total gain of 48 years per calendar year. Same with China, that rose from 41 in 1950 to 1955 to 70 in the year 1995 to 1999, gaining 65 years per year over 45 years.
It is indeed distinguished that the mortality in today's individuals are affected by certain advancement in our lives. Progressing from mortality declines to fertility transition. Hazel?
Anisha. So, fertility decline simply refers to a historical process from high fertility rates to low fertility rates with regards to the population. Between the years 1890 and 1920, most European provinces began to decline marital fertility, with an almost median decline of about 40% from 1870 to 1930. Majority economic theories regarding fertility starts with the idea about couples wishing to have a certain count or amount of surviving children, rather than birth per se. That is why most of the improvements in child survival itself are responses to parental decisions on investing and focusing more in the health and welfare of a lesser amount of children. Several factors with regards to the children, of course, have several effects. These factors include time, value, cost, and responsibility. Due to these factors, some children became more expensive. Their economic contribution are diminished by school time, and some educated parents have a more higher value of time, raising opportunity costs of childbearing. Thus, parents with a more stable and higher income focus more resources to each child. And since this raises the cost of a child, it also primarily leads to fewer children.
So, needless to say, those factors raised the cost and bearing of children, which led to couples, or rather parents, to have fewer children.
That is very much correct, Anisha. Population growth is determined by both the combination of fertility and mortality. Between the years 1950 and 2050, the actual projected trajectories for the more, less, and least developed countries are plotted, though the starting points of these paths or demographic paths still differ somehow. The convergence of fertility and mortality globally is in marked contrast with GDP per capita, which tends to separate high and low income countries. Currently, the balance or median lives of individuals living in a country today totals to a 2.3 fertility rates, barely above the 2.1 rate from the United States, while median life expectancy at birth of 68 years compared to the 77 years for the United States.
Though it is said that the demographic transition has some advantages, consequences are still present. The said demographic transition from 1,800 to 2,100 will most likely change the global population, expecting to grow from 1 billion to 9.5 billion. But this estimate still varies due to uncertain fertility rates. The life expectancy is observed due to double or even triple, with the median age increasing from low 20s to low 40s. Many developed countries experience negative population growth, such as Europe's population projected to decline by 13% by the year 2050. Changes in family structures include a sharp decline in birth rates and concentrated childbearing years, leading to a longer adult years for other specific activities. Although the patterns of childbearing and marriage age vary across regions, the trend towards fewer children per family allows for greater investment in each child, reflecting a quality to quantity trade-off. And those are the news for today's schedule. Once again, I am Mahisha Ranabaras, serving the people, covering stories and wavering truths.
Sir, tapos na po. Sir, tapos na po.